Greetings. Let us learn about bile duct strictures. Here is gallbladder with normal bile ducts, and one of the common reasons for bile duct stricture is related to surgery to the gallbladder. Here, the patient underwent cholecystectomy and the surgery went well. There was no injury to the bile duct, and that means no stricture. However, in some difficult operations involving removal of the gallbladder, there could be accidental injury to the bile duct, especially when the surgeon is dissecting out the cystic duct. There could be electrical or electrosurgical injury that eventually results in a scarring and stricture of the common hepatic duct. And as you can see here, with the stricture, there is dilatation of the bile duct above the stricture. And this is known as post-operative benign stricture. So now let us look at a normal bile duct, and in this case there is inflammation involving the bile duct in different segments, and that inflammation results in fibrosis, and the scarring leads to multiple strictures. This is a classic example of primary sclerosing cholangitis. So we've learned about benign strictures related to surgery and benign strictures related to inflammation, i.e. primary sclerosing cholangitis. Again, normal bile duct, and here cancer engulfing the bile duct, and in this setting the cancer is located in the head of the pancreas, causing obstruction to the bile duct, and this is a malignant biliary obstruction related to pancreatic cancer. One could also see, again with cancer engulfing the bile duct, near the hilum of the liver, where the common hepatic duct forms with the union of right and left hepatic ducts. That is the otherwise known as the hilum of the liver, from Cholangiocarcinoma. You could also see hilar obstruction from lymph nodes pressing on that area, secondary to metastasis of the hilar lymph nodes. So we have learned about the different types of strictures: postoperative stricture related to electrosurgical injury to the bile duct, inflammatory strictures related to primary sclerosing cholangitis, and malignant strictures either from pancreatic cancer or cholangiocarcinoma or metastatic lymph node causing obstruction to the bile duct. And you could also see that with the lymphoma. So let us learn about the different presentations of these biliary strictures. Here is a woman who presents with itching, jaundice, and fever with chills and rigors, and that is cholangitis. And an ultrasound shows bile duct dilation, and imaging studies do not show any mass. And if this were to happen in a patient who has had surgery, you should think about a benign biliary stricture. When you do the blood test, the bilirubin will be elevated, and the liver enzymes will be elevated as well. So, patient presenting with itching, jaundice, cholangitis, and a ductal dilation without a mass, this is a typical for benign biliary stricture. So let us look at another presentation, that is malignant biliary stricture. Again, the patient presents with itching, jaundice, anorexia, and weight loss. Whenever somebody has itching, jaundice, along with weight loss, you should think about malignant biliary obstruction. When you do imaging studies, either ultrasound or CT, you will notice bile duct dilation or intrahepatic duct dilation and a mass surrounding that area. That suggests that there is a malignant biliary obstruction. And when you do the blood test will reveal elevated bilirubin and elevated liver enzymes. And this is malignant biliary stricture. So let us take another case. Here is a patient, younger male, with again itching, jaundice, cholangitis, and this patient has ulcerative colitis. And ultrasound shows bile duct dilation, there's no mass. Blood tests show elevated bilirubin and liver enzymes. And in somebody who has had colitis and presents with jaundice and cholangitis, you should suspect primary sclerosing cholangitis. I hope this is helpful. Thank you.